Can male pelvic floor dysfunction be cured is the subject of this video, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Cure is quite a strong word that people use rather liberally. So when we're talking about cure, just to define the term as far as I'm concerned, cure means 100% resolution of a problem. So a lot of times when it comes to male individuals with pelvic floor dysfunction, they have had the conditions for a long time. In fact, one thing I notice in my practice, given that we focus on pelvic floor dysfunction, when it comes to male individuals, they really don't do anything about it unless it involves their penis and testicles. So unless it gets to that level, they really are very good at ignoring the problem. So when we talk about cure, really the timeline before which an individual shows in the right office can be quite long. So the chances of cure diminishes. Also, the chances of cure really depends on what we're talking about. For instance, in case of pudendal neuralgia, which is a nerve that goes through the penis, it comes from the lower back, goes through, not penis, through the pelvis, and it has 3 branches, one of which goes to the penis in males, and the other one anus, and then the other one the tissue in between. It weaves in and out of different structures within the pelvis. So if there is an impingement of the nerve within those structures, then having access to it is not possible. And a blockage of the nerve does not necessarily resolve the problem. So the cure of the condition decreases tremendously, cure meaning 100% resolution, assuming that the right steps were taken in a timely manner, because now the location plays a role. So curability is a terminology that we need to be clarifying, but if you're talking about decreasing the chances or increasing the chances of success, of course, it is, again, the same factors will play a role as to what the chances of resolution of the problems or the symptoms are. That's why it's so important to recognize the problem before it's big, both by the patient and the clinician, because unfortunately many phases of pelvic floor dysfunction appears to be a different condition, like a lower back pain or hip pain, or it's your posture, but you don't care what the posture looks like, when in reality your posture is a reflection of a lot of other things. So I hope that I answered that question, and I have done videos as to how to determine who the right clinicians are, to ask the right questions to see if the clinician that you're considering is the right clinician for your condition. There are too many factors involved, but the more you educate yourself, the better chances of success in the treatment and cure. Hope this helped.